Hi there. Today's topic is ripped from the headlines. E. coli outbreak related to onions. I love onions, and this makes me really sad. But my sweet onion friend, fear not, because they will not stop making you, and I will not stop buying and eating thee either. E. coli is a bacteria that normally lives on human bodies harmoniously. It's everywhere. It's in our intestines, on certain parts of our skin, and generally doesn't cause problems. Some of these E. coli can mutate a little bit and become pathogens. This is when they cause trouble. The big bad E. coli is 0157H7. What that means to you is stay away from this bacteria if you can. Those who become infected with it can get very sick. Thank goodness, the vast majority of people who come into contact with enterotoxic or enterohemorrhagic E. coli won't have severe disease or wind up in the hospital. So how does one know if they've been infected or if they've consumed this bad E. coli? Generally, we start hearing about outbreaks, we start hearing about places that people have been and they narrow it down to something. And so if you have eaten in one of these restaurants that has been recently implicated and then got sick soon thereafter, then that's probably what it was. The good news is that in most cases, the body takes care of this on its own by getting it out the upside or the downside. And so most people will have diarrhea, sometimes vomiting, and that generally takes care of it. You expel the bad humors, and then after a couple of days of feeling miserable, you go on about your business. The people who we worry about having the worst cases are people who start running a fever with it, people who notice blood in the diarrhea or the vomit, of course, people who are taking medicines and can't keep them down for other reasons, people who are sick enough to be hospitalized and require IV fluids, at that point certainly need to be treated. For most people, we don't like to use anti-diarrheal medicines because that actually slows the bacteria down in exiting from the body, and if it stays in the body, it can continue to multiply. So if you can avoid it, don't use anti-diarrheal medicines.
Who does number 2 work for?
That's right, buddy. You show that turd who's boss.
If someone needs antibiotics for E. coli specifically, the general choice for antibiotics in these cases is azithromycin or a fluoroquinolone like Cipro or levofloxacin. Those of you who say levofloxacin haven't been around long enough to remember when the medicine was new, which was like 20 years ago, so yes, I date myself, but it came out and there was a long E sign over Levaquin, so just FYI, it's Levaquin. So those are our antibiotic choices in most cases when people do have a more severe case of this, and generally it clears up nicely. If not treated, the worst thing that could happen with an enterohemorrhagic episode of E. coli is that people could go on to develop hemolytic uremic syndrome, which has three main things that go along with it. One is hemolysis, and basically what happens is the red blood cells hemolyze or essentially blow up, and that can cause anemia. Generally that's self-limited and it goes away on its own, but it can become severe. The uremic part, there can be renal failure involved, and sometimes people will have thrombocytopenia or low platelets, which could lead to bleeding, which could further worsen the anemia. So if someone becomes very sick from this, of course you want to treat them. The vast majority of patients, however, we can just give them supportive treatment, which means make sure they have lots of fluids, BRAT diet, which BRAT stands for bananas, rice, applesauce, toast, most, things that tend to slow down your GI tract rather than speed it up to help calm things down naturally. And adding a probiotic, some research shows that can actually help shorten the duration of a diarrheal illness. In most cases, diarrhea can last 7 to 10 days after the initial infection. So if you're feeling better but still having the trots a couple of times a day, don't be too worried. It's just going to take a little time. Grab some Align or Digestive Advantage or Florastor, and I think your tummy's going to feel better a lot sooner. Make sure you stay up on your fluids. Don't forget, like and subscribe, and stay tuned for more.